Hello, and today we're going to look at the sensory system, chapter 11. We are mainly going to focus on the eye and the eye functioning with a little bit of disorders because they're very common, and we're going to look at the ear and ear disorders. Very briefly, we will cover the other receptors such as the nose, the tongue, and other type of receptors. When we look at the receptors, the whole idea of senses is to detect internal environment, and it's the environmental change that will initiate a nerve response. That response will then be interpreted by the cerebral cortex as a sensation experience. Now notice it's an environmental change or a stimuli, and if you've ever experiment I want you to try is put one hand in warm water and one hand in cold water and then put them in the same temperature, which would be a middle one. The warm will be a cold and the cold will feel warm, and that'll show that it is the change in temperature that you determine, not necessarily the temperature itself. Okay? When we look at sensors, there are different types of sensory receptors. We're not going to go into detail, but they are classified based on the type of stimuli. Chemoreceptors are chemical receptors. Photoreceptors, light, which are your ear. Thermoreceptors are heat. And mechanoreceptors are pressure, such as the pressure sensors in your skin. Vision is basically a pressure when we look at special senses, which are ones we're going to focus on, vision, hearing, equilibrium, a wee bit on taste, a wee bit on smell, and then the general senses are pressure, temperature, pain, touch, and a sense of position. One thing to notice is that your sensory system will adapt. Receptors often become less sensitive to continuous, unimportant stimuli. An example is you may notice when you put on your shirt in the morning, but you don't necessarily feel your clothing all day unless there's a change in them or a change in the pressure. Also, you may go somewhere and notice it's cold, and then with time, that feeling of chilliness will disappear because it is not changing. Also, in your eyes, when you walk into a room, the light changing will be sensed right away, and then afterwards your eyes get used to it. Okay? When we look at the senses, the first thing we're going to look at is the eye, and these are the main objectives we're going to look at. Describe the eye, describe the tunicates, which is the part of the eye. Look at refraction and how the eye works, rods and cones. Briefly look at the muscles and then the nerves. When we look at the eye has an external protection. Your eyebrow and your eyelashes are not just to look pretty, but they are to help keep dust out of your eye. And they say the darkness of your eyebrow also can absorb extra stray light so it doesn't bounce around. Then you have your eyelids, which can close to keep to protect the eye. You have the iris, which is the color part. That's just there to look pretty. And notice that the pupil is a hole. It is not a structure. You have the sclera, which is the white of the eye, and it's covered with a clear covering called a conjunctiva. So if you've heard of conjunctivitis is an eye disease, usually called pink eye. Okay? When you look at your eye actually has tears to help lubricate it, and there are enzymes in your tears which will help fight bacteria. Your tear duct is on the top part of your eye, and it will be drained into your nose. This is why when you cry a lot, you get runny nose. I don't want to go into too much detail, but realize there are canals, and it's the naso for nose, and lacrimal has to do with your eye. You have your lacrimal gland, and lacrimation is tearing. And if you remember, when we go back to the parasympathetic nervous system, we have SLUD, SL. The L in slud is lacrimal, which means when you're tired, you will cry or your eyes will water. Okay, these are external protection of your eyes. You also have the bony orbit of your eye. You have your eyelashes and your brows. The bony orbit is very important. That is a nice protective eye socket that your eye's in, and it's actually held quite strongly with muscles, which we'll get to in a bit. When we look at your eyeball, the structure of your eye is divided into three tunics. You got the sclera and the cornea. Then you have the choroid, the muscles, and the iris, and then the retina are another one. So usually it's the sclera, choroid, and rods and cones, or the retina, are seen as the three layers of the eye. When you look at the eye, you've got the sclera on the outside, which is the white tough part, mainly for protection. Then it gets clear and it extends into the cornea. So the cornea is actually an extension of the sclera. The cornea is one of the few areas in your body where oxygen goes through directly. And this is why initially contacts were a large problem, but now you can get gas permeable contacts, so the eye gets fed by oxygen coming through the cornea. Layer 1. Layer 2 is the choroid. The choroid layer contains the blood vessels, and it also has a layer of light absorbing pigment to pick up the extra layer. Then the inside is the retina, and the retina is the light sensitive area. The retina is the area that has the rods and the cones, which we'll talk about in the bit. When we look at the way the light comes in, the light is bent to focus on the back of the eye. So when you look at it, oops, I can't get my writer. So when you look at it, the light comes through the cornea. The cornea is partly crystalline, so it will be bent. It will then go through the pupil. The pupil is a hole. Please realize the iris is the muscle around it, or the muscle around it. It's an intrinsic, meaning inside muscle, which will change shape and change size based on the amount of light in the room. The light will go through the pupil, but before it goes through the pupil, there is this aqueous humor, sometimes called the aqueous body. There is a chamber here that has a fluid in it. That aqueous humor is used to give the eye shape, help keep it round, but also, just like water will bend light, the aqueous humor will refract the light or bend the light, helping to again focus it. Then the eye goes through the crystalline lens, and we'll talk about how the lens will change to help with focusing. Then in a perfect world, most of the light rays will focus on the fovea centralis. So centralis is just a fancy Latin word for central. So this is the central area for focusing. When you look at the level of the eye, which will there is an area which is called a blind spot, or the optic disc. This is where there are very few receptors because the nerves and the blood vessels are coming through. So there are no receptors there. You have to be careful because quite often they are drawn the same, but do not mix the fovea centralis, which is a central area focus, with the optic disc, which is where the blind spot is because the nerve is coming out. Good. The light is bent by the cornea, the aqueous humor, and the vitreous humor. Then, when it comes to the function of the retina, there are two types of receptors on the retina. There are these long oblong ones called rods, and there are these cone-shaped ones called cones. Cones see color because they both have the C sound, cones, color. Then the rods will detect black and white. The rods also work very well in dim light. And as you go, oops, where did my picture go? Sorry. As you go through the periphery, there are more cones, let's try that again. There are more cones focused or central in this fovea centralis. The cones color bright light. This is where the main light is. Then as you go around the periphery of the light, the amount of cones decreases and the amount of rods increase. Rods are very good for low light, for black and white, and also for peripheral vision. Now the neat thing I just want you to be aware of is the rods and cones are not right on the top of the retina, but the connecting fibers to the optic nerve are. So the light waves will come in, be absorbed by, and then picked up by the inner part of the retina. Please realize just underneath the retina there is a pigmented layer in a part of the choroid. That pigmented layer will absorb extra light so it doesn't scatter around. Okay? Cones, color, bright light. Rods, black and white. Peripheral light or peripheral lighting, peripheral vision, and lower lighting. Good. Now, quite often when you go to the optometrist, they will take this really cool picture of the back of your eye. This shows how you have the optic disc where the blood vessels and the nerves come out. Then you have this nice healthy retina, and you have an area that's very dark, and that is the fovea centralis, where the major amount of cones are. They take a picture of the eye too because as you get older, or if you have a disease called glaucoma or diabetes or a circulation disease, what happens is the blood vessels will grow into this area. More blood vessels, the less the efficiency of the rods and cones, so that's when you will have vision problems. Okay. When we look at concerns with the eye, first off, there are muscles in the eye. There are the intrinsic muscles. The intrinsic muscles, the main intrinsic muscles are within the eyeball. These are the iris and the ciliary muscles that change the shape of the lens. Then you have the extrinsic muscles on the surface. Extrinsic is like exit, so they're on the outside. These are voluntary. They control three-dimensional vision, which is sort of the movement of your eye. When you look at the muscles on the outside of your eye, you will see you've got kind of one in each plane, so you can move up and down, side to side, and then this one helps move your eyes, I don't necessarily want to say in and out, but around, sort of left to right. And this will help you know them. Please realize you need to be aware that there are external muscles or extrinsic muscles on the outside of the eye. You do not need to know each one of their names. When it comes to the intrinsic muscles, you do need to be aware of the intrinsic muscles. There are two main intrinsic muscles. One is the iris, which will control the opening of the pupil to control the amount of light let in, and the other is the ciliary muscles. The ciliary muscles will attach to the suspensory ligaments, which will suspend the lens. So if we look at it sideways here, you will see that depending on whether you contract or relax these ciliary muscles, you will change the shape of your lens. By changing the shape of the lens, you change the amount the light bends. So if it is thin and flat, only a small amount of light bends, which is good for distant. If it is fat and bulky, it will bend the light more, which is good if they are close. As you get older, there is a disease called presbyopia. Presby means old, and you get old eyes. With old eyes, your eye does not have this elasticity to bounce back again. You have difficulty seeing things close up, and that's when you need reading glasses. This video is coming to an end. I still want to talk about more, so it will be continued on with part 2. Thank you. Until then, we'll talk about diseases of the eye.